In 2019, Australians aged over 65 accounted for almost 16% of the population. By 2057, the over 65s will account for 22% and will number nearly 9 million. Our aged care system is in a state of crisis. Abuse and neglect are too common in our aged care facilities, and it's a federal responsibility, and the Commonwealth Government has known of this crisis long before we even heard about COVID-19. The Royal Commission into Aged Care Quality and Safety was called because there was a problem. The Commission has handed down an interim report last year, and it was simply titled Neglect. So this pandemic has put extra stress on an already broken system. We know that around 50,000 cases of assault and abuse in aged care go unreported each year. Yet the Morrison government has failed to introduce a serious incident response scheme to respond to cases of assault and abuse. Such a scheme was recommended by the Australian Law Reform Commission 3 years ago. The Morrison government does nothing basically while older Australians, our mothers, our fathers, our grandparents, our friends, our neighbours are suffering. The coronavirus pandemic has exacerbated an already broken system. We've seen the horrors of the coronavirus outbreaks in aged care facilities such as the Dorothy Henderson Lodge and Newmarch House down in Sydney. After such events, Prime Minister Morrison should have been prepared for outbreaks in aged care facilities. He should have actually had a plan, but he didn't. 562 residents of aged care facilities have died so far from coronavirus. This is tragic, horrible for families. Despite public outcry and the Senate censure of the Minister for Aged Care, the Prime Minister and Minister Colbeck are still refusing to come up with a plan to fix the aged care system. Our aged care system is on fire, and the Morrison government has no plan to put it out. And this time, the Prime Minister does hold a hose. He controls the funds. And many of these problems actually started when he was Treasurer Morrison, when he cut $1.2 billion from the aged care sector. Labor has put forward a practical plan to address the obvious issues that are putting older Australians in aged care at risk. We've called for minimum staffing levels in aged care, making sure those staff have access to proper training, a better surge workforce strategy and more transparency in accordance with what the Aged Care Royal Commissioners have already called for. These are practical, helpful measures that would make a real difference to the lives of older Australians. We need to take the politics out of this and invest in these vulnerable Australians now. The Morrison government has been behind the 8 ball on aged care for years, and we're seeing the full horror of COVID-19 exacerbate matters. I will fight for you and for our elderly Australians until the Morrison government starts to fix this broken system. They need to give older Australians the care and dignity and honour that they deserve.